Good afternoon and welcome everyone to Recognizing Infection Risk in Home Health Care. This session is brought to you by Project Firstline Rhode Island under the Center for Acute Infectious Disease and Epidemiology at the Rhode Island Department of Health in partnership with the CDC. I'd like to thank you all for joining us today. I also want to thank you for all your dedication and care you deliver to our community in your healthcare role. Before I introduce myself, I'd like to direct your attention to the chat box to find the link to our pre-session survey. This pre-session survey must be completed at this time if you would like CNE, CE, or certificate of training for this session. Please take a minute to fill this out if you haven't already. You will want to do this now before the course starts. And in the next slide, I'll review the continuing education reminders. For some of you who don't know me, my name is Lisa Ledoux. I'm an infection prevention training liaison for Project Firstline Rhode Island. I've been a nurse for over 30 years, and my professional experiences have been in many different settings, such as acute care, pediatrics, ER, clinical education, home care, and management. Even though my nursing roles and responsibilities varied, infection control and prevention have always been in the forefront of my nursing practice. I'd like to introduce Dr. Kearney at this time. She is our consultant medical director with Project Firstline, and she'll be coming back to join us later during our Q&A session. So if you'd like, please take a moment to introduce yourselves in the chat and tell us where you're from. Today, I'll be presenting this refresher session to you and learn how your experiences have helped you develop your practice when providing patient care. The past few years have taught us some valuable lessons, and healthcare workers have learned how important it is to stay vigilant when it comes to infection control. This 1-hour session is approved as a nursing continuing professional development activity by the Northeast Multi-State Division Education Unit, an accredited approver by the American Nurses Credentialing Centers Commission on Accreditation. In order to receive CNE, these 4 steps must be completed. Step 1, if you have not already, you must have taken the pre-session survey prior to the start of this training. So please go ahead and take a moment to complete this now. If you have not, again, it will close as soon as we begin the session. The second step is to attend this live training. Step 3, you must complete the post-session survey after this training ends. And the post-session survey will be emailed to you tomorrow. Step 4, you must complete the post-session quiz. A link to the quiz will also be emailed to you tomorrow. Again, links to both the post-session survey and post-session quiz will be sent to you by email tomorrow, and both survey and quiz will remain open for a week, and it will close by midnight on Monday, July 17th. So for nurses who are opting for CNE, all 4 requirements, including the post-session quiz, are required. For our other healthcare colleagues here today who are opting for certificates of training, EMS continuing ed, and dental IPC continuing education, items 1 to 3 are required, while number 4, taking the post-session quiz, is completely optional for you. This is our first CNE offering. We're very excited, and we welcome your feedback regarding your experience with this. So thank you, and again, introducing yourselves in the chat. I'd like to introduce Abby Anderson, who is our Project Firstline Rhode Island project assistant. Abby will be posting information for you throughout the webinar via chat, and the Project Firstline team is behind the scenes in support of this webinar. Project Firstline is a CDC training collaborative aimed to bringing infection control and prevention knowledge to healthcare workers. We strive to reach all healthcare workers at their current level. Possibly some aspects of this course may seem basic to some of you, and also some information may be new to some of you in the audience. And as we know, some of the most basic actions and concepts are the ones that make the most impact. So quickly, some reminders before we get started. Everyone is now muted. At the bottom of your screen, you will see the Q&A box. We will address your questions you may have at the end of the training session during our Q&A session. So our agenda, welcome and introductions, we just did. We will go over our learning objectives. What is risk and how do we recognize it? Where is the risk for infection to spread in home care? Infection control actions in a home care setting. We're going to go over 3 case scenarios, have our key takeaways, announcements, end of session feedback, and then our Q&A session. The learning objectives for this session, we're going to define what is risk, recognize where germs live and how they spread infection, identify infection control considerations in a home setting. So these are factors that affect infection prevention and control in a patient's home. Understand the types of precautions, including standard and transmission-based precautions and when to use them. Apply knowledge of infection control, apply knowledge of infection risk recognition. In home care, there is a multidisciplinary team. Let me go back one slide there. In home care, there's a multidisciplinary team consisting of many different roles, such as nurses, doctors, nursing assistants, home health aides, therapists, social workers, and dietitians. You as home care workers are at times walking into situations that you were not prepared for. Your patient may not have told you that they have a fever or a family member has COVID. You may walk into a home and find your patient on the floor who suffered a fall and may be incontinent of urine and feces. When preparing for a visit, you're gathering patient medical history from a medical record. And there are times when what you read in that chart and then what you witness at your skilled visit don't always match up. I've worked as a home health nurse for many years, and I can recall many visits I thought I was well prepared for and that turned into a situation I did not expect. All home health workers play an important role when caring for your patients, and your patients look forward to your visits. Most of you see many patients. A lot of you might see 7 patients in one day, maybe more. There are days when 3 different disciplines are actually visiting the same patient on the same day. So like there could be a nurse out there, a home health aide, and a therapist, all seeing that same patient on one day. So there's a risk of infection to spread with many healthcare workers caring and touching the patient and medical equipment. There are many opportunities for germs to spread from patient to patient as you go home to home. Identifying infection risk is one of the first steps to infection prevention. Think of opportunities where infection risk presents in your workday. And in a couple minutes, I'm going to invite you to share your comments in the chat. We will now go over the concept of what risk is and how it applies to the home healthcare environment. What is risk? Think about what risk means to you. Risk is a chance or likelihood that something can cause harm. How do you recognize it? Can you think of a time when you spotted a risk at work or at home and took action to stop something bad from happening? And how did you know it was risk? Have you seen it happen before, or was it something that you were taught? Risk is a part of life. Like if you see a dog at a busy intersection while driving, you slow down, or if you see a spill on the floor, you wipe it up to make sure that nobody slips. This is our brain recognizing risk and taking action. Risk recognition is seeing the potential for a problem to happen, but seeing it doesn't mean that it has to happen. You may have seen a potential problem and you did something to stop it from becoming a real problem. You recognized risk and you acted on it. You can use this same process of recognizing risk when it comes to infection control and healthcare. If you learn to spot the opportunities for germs to spread, then you could step in to stop them and prevent infections. What makes infection risks in healthcare unique? When we think about germs spreading in healthcare, it's helpful to remember what makes healthcare a unique setting with unique challenges and risks for infection control. We think about germs and their risks differently in healthcare than in the community. You know, when you're going out and making your home visits, you're seeing your sick patients in their home. They require care from you. Because many of these patients are ill and weak, they're likely to be more vulnerable to infection. So the risk for germs spreading to them is much higher. And sometimes the things that we do as part of giving care can actually put people at risk of infection. If a patient needs an IV, their skin must be broken, right? We have to break their skin. And if there are germs on their skin or in the needle, inserting the IV can push germs into their body. And finally, we usually have closer interactions with patients during care than people in the community. We interact with many people and we touch and share a lot of things and equipment throughout the day, which are all opportunities for germs to spread. That's why infection control is different in healthcare than in other places, and why it's all the more important to recognize the risk for germs to spread throughout your workday. So a few moments ago, I asked you to think about some opportunities where infection risk presents in your workday. And at this time, I invite you to share and put some of your answers in the chat. You know, where is there opportunities for infection risk in your workday that you come across? Indwelling catheters, not discontinued in a timely manner. Yes, that's a risk right there. A lot of urinary catheters stay in. They're not discontinued in a timely manner. Very good. So here are some there are some circumstances and different situations that affect infection control during a home care visit. And recognizing infection risk in the home is not as easy as it is in acute care settings. Here are just a few factors that can contribute to infection risks in the home. We'll start with the healthcare worker. What is a healthcare worker's home care experience? Have they taken care of patients with infectious illness? Infection control training. Was job-specific infection prevention education training provided for the healthcare worker? And how frequent is that education done? Working as a home healthcare provider, you do not have your peers near you to bounce things off of or support and remind each other of certain infection control actions. Home environment factors. Some of you out there, you know, when you're going out and doing visits, you could probably relate to a few of these, which make your visit challenging in maintaining infection control. There could be clutter in the home, dirty conditions, poor patient hygiene, infestations, no running water, poor lighting, The home setting is less structured and less controlled than in a hospital environment. What about pets? I remember changing a patient's wound vac. The patient was lying in her bed, and as I'm changing, getting everything prepared and doing the wound vac, the dogs and the cat, she had a dog and a cat, they're running back and forth, chasing each other and jumping on the bed. It was quite a challenge for me to keep a sterile area, a sterile field. The patient didn't understand my challenges, as she thought it was fine. That's her normal occurrence of her pets always running around. Equipment and supplies. Are these supplies readily available for the healthcare worker and family member or a caregiver? A few months ago, I delivered a training session to the EMS workers, and we reviewed the importance for those workers to be prepared with having the proper PPE, either already donned or carrying it with them, in their bag when they're entering the home. So as we mentioned, you're not always aware of what you're walking into. So you want to make sure you have the proper PPE with you or already donned. Your hand hygiene supplies there, sharps container, disinfecting supplies, your clinical care bag, which we'll talk a little bit about your clinical care bag in a little bit. Patient factors. What is the patient's medical condition and functionability? Can they administer insulin safely? And can they properly do wound care? If not, is there a caregiver? Is there a willing and capable caregiver? Much of home care is provided by family members. Home health providers can help encourage family to participate in patients' care and assess their knowledge. Help them out with some of the questions. Are patients and their families being taught about infection prevention by healthcare workers? Can a tailored education be offered to these caregivers at a level that's easy without formal medical training? As we all know, infection control is a serious issue, and some of the patients' families mean well, and they could inadvertently be endangering their loved one due to lack of infection prevention training. As home health providers, it is part of your responsibility to teach and ensure all involved in your patient's care. Those of you who know me, I love to share stories. I had a home care patient years ago. This is going way, way back. I made a visit to bring her on and admit her to home care services. And the information I gathered from what I read in the chart was that she was a paraplegic, sustained from a horse riding accident. Her husband was her primary caregiver. And over time, she acquired pressure injury on her coccyx. And her husband thought that it was okay to use saran wrap as a dressing on her buttocks area. So he would just wrap the saran wrap around her daily. And unfortunately, the wounds progressed and she became septic. Sadly, this situation was caught too late. So here again, education to family and caregivers is crucial for all home health workers to perform. And here's another difference. One last thing too is a difference in home care versus acute care. When a home health worker leaves that patient's home, they don't have anyone there to ask a question or assess a problem immediately. Whereas in an acute care setting, you've got healthcare workers around you that are there to ask. So those were some factors that only a few. I know, I'm sure a lot of you have many other factors that you could think of that can cause germs to spread in the home care setting. So let's go take it a little bit further here. When we think about risk in infection control, we think about seeing the possibility that a germ could be spread and infect someone, and we take action to keep it from happening. As we explore the idea of recognizing risk for germs to spread in healthcare, it's helpful to start with, where do germs live, right? How do germs spread and cause infection? So we're going to go over where germs live and the different types of reservoirs. Then we're going to review the 5 elements needed to cause a person to become sick. And then we're going to just briefly go over the pathways of infection and how these germs can travel. Although we can't see them, germs are everywhere and they need somewhere to grow, a place where they can live. These places are called reservoirs, and they're found on and in our bodies and in the environment. The first body reservoir is the skin. Skin carries many germs and spreads them easily. Skin is a barrier and serves as one of the best lines of defense against harmful germs. However, the skin is also a reservoir to these germs. Broken skin, including dry, cracked skin, is likely to be more susceptible to these germs. So it's important to keep your skin moisturized and free from cracking and peeling, especially in the winter months. Many germs live and grow on healthy skin and normally don't cause harm. However, vulnerable patients are the ones that are at risk. When hands touch surfaces, germs can spread from those surfaces to that person and to others. Think of all the objects that you touch daily, whether it be at work, a grocery store, or even at home. We can carry and spread infection and not know it because most of these germs we can't see. The second reservoir is the gastrointestinal system, and it's also known as the gut. The gut refers to the entire GI system from the mouth to the anus. Most GI germs that cause infection come from the gut. And because these germs live in the intestines, they're in our stool. And these germs travel easily in stool from the gut to other places. These germs can be on the skin, around the groin, the hands, and in the environment. The germs in stool can spread onto our hands. If we don't clean our hands properly, those germs can spread to toilets, sink handles, stall doors, counters, and then potentially make others sick. The third reservoir in the body is the respiratory system. The respiratory system consists of the upper and the lower airway. The upper airway is the nose, throat, and windpipe, and the lower airway is the lungs. Many germs live in the upper airway, and germs in the nose and mouth can easily be spread to the skin and hands when you touch your face. And then from there, you can spread to surfaces and other people. One of the lungs' defenses is to cough and get these germs out. So coughing helps defend our lungs. However, coughing is also a pathway or means of transmitting that infection to someone else. And the last body reservoir is blood. Blood is sterile, and it's not supposed to have any germs in it. Some viruses can cause blood infections, such as hepatitis or HIV. If blood gets on germs in the environment, like on linens or a device, those germs are likely to grow and multiply, and they can spread. So those are the body reservoirs. Now we're going to review some common healthcare environmental reservoirs where germs live. In the next slide there, the environmental reservoirs where germs live. Starting with water and wet surfaces. Water exposures in healthcare settings and during healthcare delivery can place patients at risk for infection with water-related organisms and can potentially lead to healthcare-associated infections. Some of the places in water and wet surfaces are sinks and faucets and drains. Dry surfaces include high-touch surfaces like bed rails, door handles, countertops. Many germs found on the body, in the air, and in stool can end up on dry surfaces, and they could spread very easily. Hands can pick up germs and move them to other surfaces and people. And germs from dry surfaces can also get on devices and could spread when those devices are used on or in patients. Think about your laptop. Think of how many germs you've touched and you've been in contact with that keyboard, touching your keyboard. How often are you cleaning it? Certain germs like spores from C. diff, they can live on dry surfaces for a long time. Dirt and dust is the next environmental reservoir, and they can be found at construction sites, maintenance projects, repairs, renovations. Germs live in dirt and soil and usually do not make people sick. However, both outdoor and indoor dirt and dust contain germs that can be carried through the air and breathed in. Small construction projects. So let's say you're at your patient's home, you're making your home visit. They're putting on a room addition or doing a room renovation, or if they're even digging a pool in their backyard. These projects involve dust and dirt that can have germs in it. Devices. The last environmental reservoir for germs in the healthcare is our devices, right? This list can be endless, and I'm sure you could think of a lot of equipment that you use in your workday. Your stethoscope, pulse oximeter, INR machines, or Dopplers. If devices that are used on or in a patient's body, if they're not cleaned and disinfected correctly, germs can remain on those devices and spread to your other patients. So let's take a brief pause here and think about what reservoirs you encounter at work. Please feel free to participate and add your answers in the chat. Think of any reservoirs that you encounter in your workday. Blood pressure cuffs. Yes, that's right. Sharing blood pressure cuffs, Sarah. Thank you. Shared Dynamat machines between patients. Yes, thank you. Thank you, Kayla. Stethoscopes. First in bag on rescue. Yes, absolutely. Those are all great answers. Thank you, guys. So we're going to move on. Oh, office equipment like copiers and yes, Lori, very good. Those are other equipment that we don't think of, right? We're all thinking medical, but yeah, office supplies. All right, now that we reviewed the types of reservoirs, understanding how germs spread and how they make people sick is important in allowing you to recognize infection risks throughout your workday. So we'll go quickly through these elements and review them. In order to cause infection, all 5 of these elements must be present. They don't need to be in any special order, but all 5 do need to be present. So first, germs need a place to live. We just went over those reservoirs, right? They need a place to live, and it could be on the body, as we just learned, or in the environment. Second, germs need a person to infect. That person could be your patient, it could be you or one of your colleagues. Germs need to survive so that they're still able to make someone sick. Germs also need to get around the body's natural defenses to make that person sick. And finally, germs need a pathway because they typically can't move on their own, at least not very far. Germs need a way to get from where they live to another place or a person. Keep in mind that germ spread and infections can be prevented. Acting on one or more of these 5 elements can keep germs from spreading and keep people from getting infected, and that's infection control. We're not going to be going over next the pathways in a little bit more detail. Okay, there are 4 pathways for germs to spread. And that's listed at the bottom of this image, corresponding to the different types of precautions, which are listed on the top of the image. This is to prevent transmission of these germs. So certain germs can fall into one, multiple, or all of these categories. When we refer to transmission of infection, we refer to touch, splashes and sprays, clinical care, and breathed in. The first is through touch, which usually involves the skin, especially our hands, but it also happens with devices, which we just talked about. And it could be through a handshake or even taking a patient's pulse. Another pathway for germs is through breathed in, inhaling respiratory particles. Exhaling of infectious respiratory particles can be done by sneezing or coughing, singing or laughing. A third is through splashes and sprays. It could be splashes and sprays of blood and body fluids or water from a sink or a toilet. Germs in those splashes or sprays can get into a person's eyes, nose, or mouth, or even into a cut or a break in their skin and cause infection. And the last common pathway for germs to spread in healthcare is through clinical care tasks that bypass or break down the body's natural defenses, like the example of inserting an IV, right? That creates a pathway for germs to enter the patient's body. These infections are side effects and risks associated with a medical intervention. And we as caregivers, obviously, we do not ever want to intentionally harm our patients, but again, some of these tasks that we do, for instance, some of their dressing changes or inserting a urinary catheter, that is opportunity for germs to spread. So we are now going to move on. This is our first poll question, and I invite you to participate and answer the following poll question. And your answer is anonymous. Here's a question. There are 4 pathways for infection to spread. Which of the following is not one of the 4 pathways? A, touch, B, splash or sprays, C, breathed in, or D, wet surfaces. So we just went through the pathways. There are 4 of them. Which of the following is not one of the 4 pathways? Give you a little bit of time there. All right, let's see. Some of the answers are coming in. All right, answer is D, wet surfaces. Excellent job. And it looks like 95% of you got that. All right, good job, guys. Thank you. So now moving on, in this slide, these are just some questions that I want you to think about, okay, just in your head, before you're about to perform any clinical task with your patient. Ask yourself these following questions and think of this as like a little timeout prior to performing care. You know, what reservoirs are involved with what I'm about to do? What pathways might move the germs in and out of each reservoir? Is it possible that the task I'm about to do will cause germs to spread from a reservoir? And finally, what actions can I take to help stop the spread of germs and prevent infections and protect patients, myself, and my coworkers? Just some food for thought there, some questions to think about. Okay, so far, we've learned what risk means and how to recognize infection risks. We reviewed where germs live, the different reservoirs, and how they spread to cause infection. So now let's review how we can protect ourselves and our patients from the spread of infection. So earlier I had mentioned the clinical care bag that most of you have. So when home health care workers make a home visit, they bring various medical supplies depending on their role. Where do they put all those supplies? How do they assure they are safely transporting everything house to house and maintaining proper infection prevention? All home health clinicians have a clinical bag that they carry their medical equipment such as stethoscope, pulse ox, a BP cuff. This bag holds many medical items needed to care for their patients safely and effectively. So how are they going to maintain infection control measures? Adhering to proper technique will decrease the risk of transmitting germs from patient to patient or from patient to healthcare worker. So let's review some of the steps. You go to your patient's house, you're going to carry your bag in. Never want to place your bag on the floor. If you do not have room to place it anywhere, this is where creativity jumps in. You can hang it from a chair, a door hinge, a doorknob, but you don't want to place that bag on a couch or a chair. If that's the only place you have to place your bag, you always make sure you have a barrier, all right? You want to use a disposable barrier. Place a disposable barrier down on a dry, hard surface is the optimal situation, and then place your bag on that. You always clean your hands prior to entering the bag. Take out items that you're going to be using and place them on the barrier. You want to assure you have taken out everything you will need to decrease the number of times you go in and out of the bag. So if you forgot to take something out, you're going to have to clean your hands prior to re-entering the bag. Keep the bag closed when not in use. You want to prevent any chance of germs or other things entering the bag as much as possible. So here's where I'm going to tell you another little quick story. I love sharing my stories. When I was a nurse manager in home care years ago, one of my nurses made her home visits, right? She saw a patient who had a cat and some kittens at the house. This nurse finished her visit and went to her next visit for that day. When she arrived and went to open her clinical bag at that patient's house, surprise, out jumped a little kitten. And this is a true story. No lie. And so at that prior home visit, her clinical bag was not closed up, and that allowed this little kitten to jump in and take a ride with her. So reminder to all home care clinicians, keep your clinical bags closed when you're not using them. Okay, when care is done, clean your items and place them on the clean barrier until they're dried. Clean your hands and place decontaminated items back in the bag. Any items that cannot be cleaned in the home should be placed in a plastic bag, sealed, and placed in a dirty container. That was just a brief overview of that clinical bag, but I find it's very important because home healthcare workers, you're using clinical bag for all your visits. So next, standard precautions. As you're going about your workday, there are certain things that you are likely already doing to reduce the risk of spreading germs, like cleaning your hands between tasks or cleaning and disinfecting shared medical devices. Standard precautions are the minimum infection prevention practices that apply to all patient care, regardless of suspected or confirmed infection status of the patient in any setting where healthcare is delivered. Because risk will always exist in healthcare settings, we follow these standard precautions to protect patients and ourselves. The use of precautions in home care differs significantly from those applied in hospitals. In most cases, the use of gowns, gloves, and masks in the care of a homebound patient is recommended to protect the healthcare provider, not the patient. Organisms such as multi-drug resistant organisms may be transmitted to other home care patients through inanimate objects or your hands. Therefore, home care patients known to have a multi-drug resistant organism should be cared for through use of appropriate barriers. Reusable equipment such as stethoscopes and blood pressure cuffs should remain in the home. Or in some cases, can you use a patient's own equipment? I think that now more people at home have their own blood pressure cuffs or their pulse oximeters. So if you can use theirs, that's probably a best choice there. And if practical, such patients should be seen as your last appointment of the day. If this is not possible, visits should be, scheduled to avoid seeing patients at risk, such as those requiring wound care or oncology patients. After seeing a patient with highly infectious organisms. Adhering to standard precautions are frequently where healthcare workers can become complacent. We are very, very busy. So the extra few minutes to wash your hands more thoroughly or clean used medical equipment thoroughly can seem like it takes way too much time, but they are the small things that can make a huge, huge difference for your patients and yourselves. As healthcare workers, you have an obligation, right, to your patients, your coworkers, and your families to maintain standard precautions for infection control. So let's just go through these. First one is cleaning your hands. That's the most important principle of infection control. Most critical protective measure against cross-contamination. Unless hands are visibly soiled, an alcohol-based hand sanitizer is preferred over soap and water in most clinical situations. Here are just a few other moments when you should be cleaning your hands during a home care visit. Immediately before touching a patient, before performing an aseptic technique or handling invasive medical devices, before moving from a soiled body site to a clean body site on that same patient, after touching a patient or the patient's immediate environment, after contact with blood, body fluids, or contaminated surfaces, and immediately after glove removal. Use of PPE. Wear gloves whenever there is potential for contact with blood, body fluids, mucous membranes, non-intact skin, or contaminated equipment. Do not wear the same pair of gloves for the care of more than one patient. You never want to wash your gloves. They're not reusable. Clean hands immediately after removing gloves. And wearing protective clothing, gown, booties that cover skin, and personal clothing during procedures or activities where contact with blood or body fluids is anticipated. Wear mouth, nose, and eye protection during procedures that are likely to generate splashes or spattering of blood or other body fluids. And you always remove your PPE before leaving your home visit. And moving on to your next. And then washing your hands right after. Respiratory hygiene and cough etiquette. Covering mouths and noses when coughing or sneezing. Coughing into your elbow and not your hands. What about using, people will use tissues and they'll either put them in their pocket or put them on their bedside table. We want to teach them to not use that practice. Teach them to put them properly dispose of them in the wastebasket and to wash their hands, clean their hands immediately after. Safe injection practices. Sharp instruments can act as a source of cross-contamination if not disposed of properly. This can be like the healthcare worker administering a vitamin B12 IM injection, or if the patient self-administers insulin or Lovenox. Where do they dispose of their used needles? Is it in a safe puncture-resistant container? Some home care patients will discard used needles in sharps container or a puncture-resistant container such as a laundry detergent bottle or a coffee can. As clinicians, you should be equipped with a biohazard container for used needles, sharps, venipuncture devices. You should place the full containers where it's recommended by your facility's policy. If the instrument is disposable, healthcare providers must assure safety cap on and placed in the approved disposable container. When you go to discard that used needle and syringe, always check that the container is not overfilling, and do not recap your needles after use. Many sharps injuries are still happening with recapping. Clean and disinfect environmental services. Clean and disinfect your shared medical devices. What about your tablets, your laptops, your phones, writing utensils? Always clean and disinfect those. Laundry. When you dispose of soiled linens, carry those items to the laundry bin. Keep soiled linens rolled up containing any infectious material. So you want to keep it all rolled up and keep it away from your body when you go to dispose of it. And waste management. Any waste that's produced from a procedure must be disposed of properly. If you're doing wound care and you're discarding the dirty, saturated dressing material in a bag, tie it up when done to prevent it from potentially infecting someone else. So those are our standard precautions. And here is our second poll question. What procedures are standard precautions? A, hand hygiene. B, clean and disinfected environment. C, respiratory hygiene, cough etiquette. D, none of the above, or E, all of the above. So give you a few minutes to give you a little bit of time to answer that. And I'm seeing the answers coming in. All right, 96% of you got E, all the above. Excellent job. Excellent. So as we just discussed, standard precautions, they're always used. Now this is, now we're going to talk about transmission-based precautions. Transmission-based precautions are the second tier. In this image is a classic division of transmission-based precautions in healthcare. Some of these posters may look familiar to some of you. They're usually posted in hospitals or skilled nursing facilities, outside of a patient's room. And here's another difference from home health versus healthcare facilities. Home care, you don't have any signage posted upon entering a patient's home, right? The terminology contact, droplet, and airborne are used only when referring to precautions. Each different type of precaution has the recommended PPE to use depending on the patient's diagnosis. So the yellow poster is contact precautions, the green poster is droplet precautions, and the blue poster is airborne precautions. Any additional precautions and PPE to use is based off of your assessment and critical thinking. So say if you have a patient on contact precautions for C. diff, and that patient also has a G tube that needs to be flushed. The potential for sprays and splashes can occur, so you would wear a mask and eye protection along with your gown and gloves. And again, the terminology, I just want to make this clear, contact, droplet, and airborne, it's used only when referring to precautions. Well, as we all know, COVID has, we've had a lot of changes now recently as of May. What is a precaution for COVID in home health care? As you see here, it covers both contact and airborne precautions. Here is the PPE recommendations for healthcare workers caring for patients with suspected or confirmed SARS-CoV-2 infection. So patients with suspected or confirmed SARS-CoV-2 infection will wear gown, gloves, eye protection, N95 or higher level respirator. CDC recommends that healthcare providers use N95, being that it offers the highest level of protection, along with eye protection, gowns, and gloves, depending on the situation. We have learned how to recognize infection risk. We reviewed how some actions can cause risk in the spread of germs and infection. And we reviewed precautions and how we can protect yourselves and others, especially your patients. Now let's apply all that we reviewed in this session and go over, we have 3 clinical case scenarios. Okay, scenario 1, you're admitting a patient to home care services. The patient is 78 years old. She is 2 weeks status post-abdominal surgery, and she was diagnosed with C. diff 2 days ago. What precautions should you perform, and what PPE would you wear? So if you'd like to share and participate and put some answers in the chat, what precautions? So she is 2 days post-op. She's diagnosed with C. diff 2 days ago. Contact. Good job. So yes, in this case, first of all, you're always going to use your standard precautions. And then the additional would be contact precautions. Excellent job. Good job on that. All right, we've got our next scenario. You arrive to your patient's home to remove her surgical staples. You learn her husband tested positive for influenza 2 days prior. Your patient reports she started with the following symptoms just this morning: slight fever, cough, and a runny nose. What precautions should you take during this visit, and what PPE would you be wearing? Okay, we've got droplet N95. Now this patient's got influenza, right? So you're going to be doing, in this case, we're going to be using our standard precautions, right? I always our standard precautions. And then in addition, it'll be droplet and contact precautions. Okay, so the PPE would be a gown, gloves, and mask. A surgical mask should be worn by you as a healthcare worker with suspected. So in this case, this was lab confirmed influenza. So we know that. Proper hand hygiene prior and post-patient care. And actually droplet and contact. Yeah, thank you all for participating. Here's also, this scenario is a great opportunity for you to teach your patient and family about respiratory hygiene, right? The frequent hand washing, coughing into the elbow, discarding that used tissue in the garbage, not on the bedside table, and then performing hand hygiene right after that. And also cleaning, high touch surfaces like any bedside tables or end tables. All right, you guys are doing awesome. We have our last scenario here. And let's see. Your patient has a Foley catheter and diagnosed with VRE. He needs bathing and a brief change, and his Foley bag needs to be emptied. A quick review of VRE for some of you. Vancomycin, VRE is vancomycin resistant enterococcus. And VRE is usually spread by direct contact with hands, environmental surfaces, or medical equipment that's been contaminated by feces of an infected person. Okay, so what precautions would you take here, and what PPE would you be wearing while performing clinical care? All right, standard contact eyewear. Excellent answers. In this case, okay, again, standard precautions. In addition, you're going to use contact precautions. Okay, and as far as PPE, when providing healthcare, providing care to this patient, you should have your gloves. You're going to clean your hands, right? You're going to obviously do your hand hygiene. A disposable gown should also be used if the type of care involves washing or turning the patient. And in this case, you're changing his brief and then emptying the catheter bag. When caring for this patient, you want to work from clean area to a soiled area. You do not want to go from dirty to clean. So after emptying that Foley catheter bag, we're going to clean your hands before you go and turn that patient. And yes, again, you are going to use your own judgment if you feel that you want to wear, additional protection, your gloves. Your mask, depending on any splashes. You guys all did a great job with those. I really appreciate it. Good answers. So before we start wrapping things up, if you think of all that we just reviewed today, what actions would you take to decrease the risk of infection in your workday? So again, if you want to share and participate, what actions would you take to decrease the risk of infection in your workday? Washing hands more frequently. See some others. Stay up to date with vaccination. Hand sanitizer before using office equipment. Yes. Cleaning equipment after each run. Yeah, those are all great. Clean all surfaces many times. Good job. Thank you all. I appreciate that. Okay, our key takeaways from today. Risk recognition is seeing the potential for a problem to happen. You control healthcare infections when you recognize infection risk. And knowing where germs live helps stop the spread of germs. There are 5 elements that must be present to cause infection, and there are 4 pathways for infection to spread. Always consider what type of precautions may be needed for your patients. So before we wrap up, I want to remind everyone that certificate of training requirements. Okay, certificate of training requirements are just a quick review again: pre-session survey filled out, participation of this entire webinar, completion of post-session survey, and post-session survey will be emailed tomorrow, which is July 11th, and it closes July 17th at midnight. For CNE only, the post-session quiz needs to be completed. Certification of training will be emailed July 20th. And post-training resources and this PowerPoint will be emailed sometime this afternoon to you. If you did not enter your email earlier in the chat box, please feel free to enter it now to be added to our distribution list of upcoming trainings. And you could also email us directly. You can follow us on social media. Follow Project Firstline Rhode Island on social media. We're on Twitter, Facebook, Instagram, and LinkedIn. And I hope to see you all again and bring your colleagues to our next session. Our next session is going to be July 24th, 12 to 1. And my colleague, Jacob Pagero, will be presenting this session live, recognizing infection risks in home care in Spanish language. And here are the references that we use for today's session. Next slide. There we go. Yeah. I invite you to please take the 3-question poll on your screen. This poll helps us to improve future sessions and assess your learning needs and requests. This is not the post-session survey. The post-session survey, remember, is going to be emailed to you tomorrow. This is our poll. This is our poll that helps us with our future session, trainings that we're going to be presenting. On behalf of Project Firstline Rhode Island, we thank you for joining us today, and we hope to see you all again. You all work so hard in your various healthcare roles. Thank you all again for joining us. We'll hope to see you at our next session.